Good morning, everyone, and our distinguished chairman, and our guests and friends. And I'm the assistant professor at Chen Medical University. I'm the director of the Annan Hospital at Annan University in Taiwan. Okay, first of all, I bring a message and inspiration from our honored Professor Huang. And he is our Chinese Medicine Research Center director at China Medical University. And he greetings our 1995 ISAMS Congress.
Distinguished chairs, colleagues, and friends, good day. I'm Huang, director of the Chinese Medicine Research Center at the China Medical University in Taiwan. It is a great honor to greet you at the Korean-Taiwan Acupuncture Symposium in ISAMS2025. Although I cannot be with you in Busan today due to my lifetime career award ceremony in Taichung on October 24, I'm delighted to join you to vision and to celebrate our shared progress in this conference. My sincere thanks to the ISAMS organizer and host, and to our colleagues at the Acupuncture and Meridian Science Research Center, or MSAC, Kyunghee University. Your dedication to rigorous, innovative research in acupuncture continues to set a global standard. The bond between CMU and Kyunghee goes way back and runs deep. Last November, our two institutions inaugurated a joint research laboratory linking CMU's Chinese Medicine Research Center and Kyunghee's MSAC, making a new chapter in collaboratory discovery across acupuncture, mechanism, imaging, immunology, and translational research. This builds on decades of exchanges dating back to 1970s and reflects a shared vision to integrate traditional medical technology knowledge with modern biomedicine. The Korean-Taiwan Joint Symposium is not only a session on the program, it is a platform that aligns mechanistic insight, clinical evidence, and technology-enabled method for acupuncture research. Today, CMU is represented by Professor Chen and Dr. Chen Huang, who will deliver their talks and will also engage in scientific dialogue on behalf of our team. I thank them and all presenters for advancing rigorous and impactful work. Together, we can, 1, launch joint research multi-center studies that bridge preclinical mechanism with clinical endpoint. 2, build shared data and biorepository resources to accelerate validation. 3, expand student and scholar exchanges, cultivating the next generation of acupuncture scientists. And 4, pursue co-funded grants and industry partnership to translate discovery into patient benefit. Congratulations to all organizers and participants. Though I'm not present, I'm fully committed to our collaboration. I wish you a successful symposium and looking forward to our Korean colleague in Taichung very soon. Thank you.
It's my honor and my privilege to share my research in the integrative approaches of chemotherapy. And it is shortened as CIPN. And in this presentation, I'll show our clinical data and the basic mechanisms of our research, and the therapeutic range will include acupuncture and Chinese herbal medicine. Okay, CIPN is debilitating side effects of chemotherapy and other cancer patients caused by damage to the peripheral nerves away from the brain and the spinal cord. The prevalence is staggering, ranging from 19% to 85% depending on the agent and the dose. A significant of 70% of patients on chemotherapy developed CIPN during their first month of treatment. Alarmingly, 20 to 30% of these cases converted to chronic and persist and highly pharmacoresistant CIPN in this case. This chronic state often exhibit a phenomenon called costing, where mild neuropathy worsens and a new form develops, persisting for months and progressively aggravate the conditions. The symptoms of our CIPN are typically symmetrical, starting from the end of our limbs and to our bodies. And the symptoms will include the tingling of pins and needle sensations, pain and burning numbness, and sensitive to hot or cold, or difficulty with fine motor skills such as writing and buttoning and unbuttonings, and even the picking the small objects will be difficult for those patients. So it is important to find a better way to conquer this adverse event. Nowadays, the duloxetine is endorsed by the ASCO. However, the clinical use of duloxetine is limited, and it is not universally applicable to all patients and has limited efficacy in persistent CIPN. So the CIPN is complex because different agents attack the nerve system in distinct ways. For example, toxins including paclitaxel and docetaxel predominantly cause sensory neuropathy and disrupt microtubules and mitochondria. And platinum compounds, including paclitaxel, including cisplatin and oxaliplatin, primarily also cause sensory issues and affect dorsal ganglion cells and ion channels, like figures in above. And the mechanism of toxin-induced neuropathy we will depict it in these figures, and it will cause the cascade of events, including microtubule disruption and mitochondrial damage, leading to reactive oxygen species release and activation of immune cells and glial cells, culminating in neuroinflammation and altered excitability of peripheral nerves. So in our research, this presentation, we will include a result of our randomized control trials and basic research. In our randomized control trials, we will include the acupuncture result and the topical herbal compounds like menthol. They will expand it from our Professor Huang Chen's study of the menthol on this stroke. And in our basic research, we will include the result of the findings from the electroacupuncture on CIPN and our oral compound panel. And it was published, the pilot study was published in 2021. And in this pilot random recognized the therapeutic importance. Our team initiated this at first, a single center randomized sham control trial to investigate the effect of variant acupuncture on CIPN. And the patients with stage 1, 2, 3 breast cancer, focus on breast cancer, who had completed chemotherapy will include this study, recruited in this study, and the participants will receive 15 manual acupuncture treatment, which includes twice a week for 6 weeks and then once a week for 3 weeks. And outcome measures will measure the pain severity, the neurotoxicity, and quality of life, and touch perception threshold, especially the von Frey monofilament test. We tested touch perception threshold in our study. I think this is the first successful study that used the von Frey test to be an objective measurement in the RCT. And our selected acupoints will include the LI11 and LI4, PC6 and CV6 and ST36 and SP6. And recruited time will be January 1st, 2018 to July 31, 2020. In your primary outcome, we have shown that variant acupuncture significantly alleviated the average pain severity compared with the sham acupuncture at 9th week, and they have significance between groups and within groups. And this is the Von Frey test for human, and this is we test the it is the sensory test. The higher the scores, the worse the pressure, the touch pressure perception threshold. So in our Von Frey test, the variant acupuncture improves mechanical touch pressure perception threshold at our left hand palm and left foot plantar and right foot big toe tip and right hand palm and right foot plantar. It means the acupuncture on CIPN is not only relieve the neuropathic pain but also relieve the neurotoxicity. And increase our sensory feelings in our patients. And the between group improvement, the result of the between group improvement, it shows that when assessing the change in pressure perception threshold from baseline, the variant acupuncture group showed a significant greatly improvement at the left hand middle fingertip and the right foot big toe tip compared to the sham group. Okay, so the importance of this pilot study that we successfully used the objective Von Frey monofilaments to demonstrate the improved touch sensory sensitivity. Furthermore, under the leading of Dr. Vice Dean Huang Chen, and we have conducted a randomized phase 2 randomized sham control clinical trial, and we tested again and increased the numbers of our participants to evaluate the efficacy of variant acupuncture on CIPN. So this time we conducted a randomized sham control trial and recruited another group, the wasted leg group, in our study, and more intensive regimen, about 20 sessions over 8 weeks, including 3 times a week for 4 weeks and then 2 times a week for 4 weeks, and then we don't no any treatment and follow up for 4 weeks in this study. And the primary outcome changed to the FACT GOG NTX, that we measure the neurotoxicity this time in the large scale randomized control trial. And we selected our selected acupoints increased 1, 2, 3, 4, 5, 6, 7, 8 acupoints, and we increased the Ki2 and LR3 in this large scale and randomized control trial. This time we recruit the patients from 2021 to 2025, and we expand the cancer patients. Not only breast cancer patients, we also recruit the colon cancer patients in our study, and they were in the stage 1, 2, 3. The primary outcome of the neurotoxicity score and the treatment demonstrated a significant improvement in neurotoxicity symptoms at 8 weeks intervention. It also improved the pain severity in this study, and improved at fourth week and the 8 weeks. But however, the Von Frey test, we are still analyzing, but not, up to date, the left middle fingers has improved between groups. The result of the between groups has improved compared with variant acupuncture group and the sham acupuncture group, and it's inspiration about this result, because I think CIPN really alleviate the neurotoxicity on CIPN patients. So in these key findings from the randomized control trial, I think we introduced the Von Frey monofilament test as an objective assessment tool, and we also alleviate the neuropathic pain and relieve the neurotoxicity symptoms. And about the the basic research about the electrical acupuncture. We introduced the paclitaxel-induced peripheral neuropathy in B6 mice. And we apply electroacupuncture for 10 days at Yang Chen and Taichung acupoint. And we can show that the 10 days of electrical acupuncture treatment at GB34 and LR3 acupoints significantly reduced paclitaxel-induced mechanical aldynia in B6 mice. And we found that FGF21 might be the neurotrophic factor that help us to relieve the CIPN symptoms. And it also improved in the FGF knockout mice to improve the to prove that FGF is important in alleviating PIPN model. Also, we positive approved that when we injected 5 days recombinant FGF21 protein, it improves paclitaxel-induced mechanical aldynia in B6 mice. So we also approved that the TNF alpha will improve after the electrical acupuncture administration. Okay, so in our animal study, the results suggest that electrical acupuncture can protect from the PIPN aldynia in mice, and this effect associated with alleviate FGF21 neurotrophic factor in dorsal root ganglion. And also, okay. Now we are also interested in traditional Chinese herbals. It called Painol. It is from the Mudan Pi, and the name is Mudan cortex. In Painol, it has analgesic and antipyretic and antibacterial effects. It also affects macrophages and microglia cells also. And so in our study, also in the PIPN models, and we oral administration 13 days of panel, and we found that they have protective effect in our B6 mice. And in the biomedical analysis, and we found that 200 milligram per kilogram panel will increase adiponectin. And in our adiponectin knockout mice, we found that Painol 200 milligram per kilogram partially alleviates CIPN in adiponectin knockout mice. When we injected 5 days of IV adiponectin, and it partially alleviates CIPN in B6 mice. We also approved the effect of the adiponectin in our Western blot. Also, we analyzed the phospho-AMPK in the dorsal root ganglion of our B6 mice. So the Painol 200 milligram per kilogram will increase the level of phospho-AMPK in dorsal root ganglion and in the spinal cord in our study. So in this Painol study, we has a multiple side effect on relief PIPN. Adiponectin may play an important role in the relief of PIPN by Painol, and it is likely that phospho-AMPK affects the AMPK signal pathway. It might involve in mediating the effects in PIPN. At the last, the final research just follows with the inspiration of Professor Chen's research. Investigate menthol, and we conducted a pilot open-label study using menthol-containing gloves on CIPN patients. And we used 4.69% and 8% menthol groups for 5 minutes following assessment 2 hours later. And we found that the CIPN improved also in our CIPN patients. Okay, so in my research, in my report, the overall conclusion will be in the below. We approved the acupuncture efficacy in our study, and it improves the touch pressure perception threshold and reduce neuropathic pain. And in molecular mechanism, and we found that FGF21 might be the effective factors for the electrical acupuncture. We also found Painol might be potential drugs for treating CIP, and it related might be to the adiponectin. And we also found that mental treatment may be a potential method to help the CIPN. Okay, so in summary, in my presentation, we will combining the interventions with molecular insight. We are advancing toward more effective and targeted therapies for chronic neuropathic pain in our CIPN patients. And the last, overall to our goal, our work aims to ensure the patients to relieve the CIPN from their chemotherapy. 等一下 I bring experience from my patient.
大家好，我是陈慧萍，今天要分享针灸改善我神经损伤的真实案例。我是111年9月确诊移转性乳癌患者，当时癌细胞移转脊椎。大家好，我是陈慧萍，今天要分享针灸改善我神经损伤的真实案例。我是111年9大家好，我是陈慧萍，今天要分享针灸改善我神经损伤的真实案例。我是111年9月确诊移转性乳癌患者，当时癌细胞移转脊椎，压迫神经，双脚几乎无法行走，知觉感应逐渐丧失，送至成大医院急诊室，紧急开刀清除压迫脊椎神经癌细胞。后续复健从坐轮椅到拿辅助助行器行走，再逐步可自行行走，除无法跑步、行走时脚活动度9月确诊移转性乳癌患者，当时癌细胞移转脊椎，压迫神经，双脚几乎无法行走，知觉感应逐渐丧失，大家好，我是陈慧萍，今天要分享针灸改善我神经损伤的真实案例。我是111年9月确诊移转性乳癌患者，当时癌细胞移转脊椎，压迫神经，双脚几乎无法行走，知觉感应逐渐丧失，送至成大医院急诊室，紧急开刀清除压迫脊椎神经癌细胞。送至成大医院急诊室，紧急开刀清除压迫脊椎神经。
So I'm sorry for that because these patients that she entered into my clinics at September this year, and he conquered. He felt recovery very soon while she got at the second time of acupuncture, and the case touched me because she cannot walk through the across the road. Well, because she had hardly in walking after she received the chemotherapy. Yes, and so she was very touched about the effect of the acupuncture on CIP, and it relieved her pain and gained their confidence in our research. In our therapy. Yes, so I would like to show that because her words touched me, and also I would like to share her experience to all of us because she let us know the effect of the acupuncture is very powerful, and we need do more. And we need expand the effect of our acupuncture and do more research in the future work. Yes. So
Yeah.
thank you so much.
Thank you.